Assalamu alaikum, everyone. My name's Samanti. It's been a long time since I've seen everybody. Thanks for tuning into our quick episode today. So just to reintroduce myself, my name's Samanti Hussain. I'm an OBGYN physician in Kirkland, Washington. So I work with pregnant moms, I deliver babies, but I also take care of women when they have gynecologic symptoms or issues outside of pregnancy. So today I've been invited to talk a little bit about the COVID vaccine in pregnancy. There have been a lot of questions about this in clinic, and I thought, what better way to kind of disseminate what we know now in the United States and kind of give everyone an update. I'm sure this is a very hot topic for all of you, so feel free to send her Will a message if you have any additional questions. Without further ado, I'm going to go ahead and give a talk. So before I delve into this, I want to let you know that these are the most up-to-date recommendations from the American College of Obstetrics and Gynecology, which is the big overseeing very reliable organization, OBGYN organization in the United States. And I'm also going to talk a little bit about what the CDC says, which is the Center for Disease in the United States. And both of these entities, as you know, are very well respected, and I would trust both resources immensely. And the big take home is, I'm just going to give away the answer in the beginning, is that the COVID vaccines, which include the Johnson & Johnson, Moderna, and Pfizer, are believed to be safe in pregnancy. And as OBGYNs, we strongly recommend it. And in fact, we even say that if you have no hesitation about it, you don't need to ask your OBGYN while pregnant. You should just go ahead and get it. But this comes with a grain of salt that, yes, technically we have not done the long-term studies simply because the vaccines are so young, but we can extrapolate from given early data so far and how well women have been tolerating the vaccine so far, and what we know about vaccines, that it is safe. তো মানে বাংলায় বলছি যেটা COVID vaccine আমাদের ইউনাইটেড স্টেটসে যেটা available, so Moderna, Pfizer, or Johnson & Johnson, এই তিনটা আমরা মনে করি in the medical community যেটা এটা safe. Before I talk a little bit about the vaccines, just to let you know about how vaccines work, one very common concern that my patients have is vaccine to China, flu vaccine, for example. I mean, the China because like I feel sick, I don't want to get the flu vaccine. And so, we actually say that that's a good thing. That's the kind of an expected side effect of the vaccine, because the way vaccines work is that they give you, it's a sort of a very non-scientific or simplistic way of talking about it, but vaccine kaj kore by giving you a small preview of the disease so that you develop an immune response to it without actually going through that severe consequences of the disease. So when you say you have a little bit of a febrile reaction or pain, those are all things that we almost kind of want you to feel, because it means that your immune system is responding to it. So side effects, as annoying as they are kind of exactly evidence that the vaccine is working. So don't use that as a reason to not get the vaccine. See that as a opportunity to deal with the disease with milder symptoms so that you don't have to actually get the severe diseases. So that's how vaccines work. Number two, we know for pregnant moms, the COVID disease, the COVID virus is much, much more dangerous than the vaccine. It's just a known fact. Pregnant moms are always more vulnerable to disease because they're immunocompromised, so that their immune system acts calm, so you're more likely to get sick when you're pregnant. I know from clinical experience that pregnant patients that get the flu virus are much sicker. I've treated several pregnant patients with the flu virus in the ICU, but how many times do you see that a non-pregnant woman gets the flu virus and they don't necessarily need to go to the ICU? Also COVID, I've seen COVID in pregnant moms. I've seen one that got intubated that was needed to be treated in the ICU. She was otherwise young and healthy. I'm sure that if she wasn't pregnant, she would have been fine. So knowing that pregnant moms are vulnerable, knowing that if you're a pregnant mom, you are extra vulnerable. You're kind of like apnar nani and daddy, when you worry about your grandmother and grandfather about getting sick from COVID because they're going to be more unwell from it, you're kind of in a similar category. So remember that. So knowing that you're more vulnerable and knowing that these vaccines work, these are the reasons why ACOG and the CDC recommend that you get the vaccine. So that's number one. And we know that ICU admissions are higher, risk for mechanical ventilation is higher, ECMO, and even death is at higher risk for pregnant moms. So the next step is, minorities are more affected. Though we know the Hispanic and African American population or Blacks in the United States are more affected by the COVID virus. And so kind of extrapolating off of that as Bengalis, as a minority in the United States, I wouldn't be surprised if COVID disproportionately affects our communities more. Though on that vein of thought as well, knowing that it can affect our communities more, all the more reason to get the vaccine. This is during pregnancy. There's also a lot of questions about, should I get the vaccine before getting pregnant, or is it okay to get the vaccine after delivering? Yes, those are even more well supported, that you should get the vaccine then. Obviously before getting pregnant, because that's, I think the main concern. People feel that, pregnancy trauma is going to affect my baby. Getting it before you get pregnant is a smarter idea. We recommend you get both vaccines and then you start trying for it. Now, let's say you're like, oh my gosh, Dr. Hussain, I just got my first vaccine and I'm pregnant. What do I do with the second vaccine? Go ahead and get it as scheduled. Studies show so far that it is absolutely fine. And since you've already committed to it, go ahead and get it. That's what ACOG recommends. Postpartum, after delivering, the big question is breastfeeding. Is it going to affect my breast milk supply? Absolutely not. Just mechanistically, it makes no sense. Why would a virus? It doesn't even interact with the breastfeeding pathway. Does it affect the baby? Does the virus somehow get into the milk and cause harm to the baby? No. The virus goes in your body, stimulates an immune response. You develop antibodies. Antibodies are the good stuff. Those are the good stuff that protects you against the virus. And that actually has been shown to be secreted through the breast milk. Preliminary studies show that it's actually one of the reasons why we recommend breastfeeding in general. The COVID or AGE, we always recommend breastfeeding because mom's antibodies are known to be transmitted to the baby, and the baby gets that extra immune boost because छोटे बच्चे देख के vaccine करा जाए. And so they get a lot of that, what we call passive immunity from their moms. So even all the more reason to get the vaccine if you're even breastfeeding. We also see that the antibodies are present in the breast milk when moms get the vaccine in the third trimester. Now, if you're in the first trimester, don't wait till the third trimester to get it. Just go ahead and get it because the risk of you getting in that 6 months is much, much riskier. And so to kind of go down to your 3 vaccine options. Now, I apologize. I know that a lot of our listeners and viewers are outside of the United States, and they are being offered the AstraZeneca vaccine. Though I am strictly talking about what's offered in the United States, primarily because I'm a physician in the United States, and I'm going to be looking at resources that I trust in the United States. I can't talk on behalf of AstraZeneca, but what I can do is if there's significant interest in learning more about that vaccine pregnancy, I can reach out to some of my colleagues in other parts of the world. Or if you, as a viewer, are a provider in another part of the world and have information on this, please do let us know. We would love to have you give a talk on this. But I'm going to talk about the Moderna, which is an mRNA vaccine, as well as Pfizer, which is an mRNA vaccine. So Pfizer has now been approved for individuals 16 years and older. So if you are 16 and pregnant, or you have a 16-year-old child, definitely give that to them. Moderna is an mRNA vaccine approved for individuals 18 and older. But going back to Pfizer is a 2-dose regimen. They're 3 weeks or 21 days apart. Moderna is also a 2-dose regimen. They are 1 month, so 28 days apart. And then the Johnson & Johnson monovalent vaccine. This is not an mRNA vaccine, but it basically acts by having so these are very technical terms, so I don't want to bore you, but mRNA vaccines and the Johnson & Johnson are different because the mRNA is a small segment of messenger RNA that goes inside cells and teaches the cells how to make a protein that triggers that protein that is similar to the COVID virus, and then your body sees that protein and it develops an immune response. So that's how the mRNA vaccine works. Our Johnson & Johnson, I believe, is kind of like a small piece of the virus that goes in your body, and your body creates an inflammatory response. But if you are an immunologist and know a more technical, better way to explain it, let me know, and I will relay that to our viewers. So, a little bit about mRNA vaccines, or just to backtrack about vaccines. Though we are using vaccines interchangeably, but there are many different kinds of vaccines. I just talked about the monovalent vaccine and mRNA vaccines, which are the COVID vaccines. Ito ay onorokong vaccine. So, for example, there are live attenuated vaccines, which are the types of vaccines we know are not safe in pregnancy. Though this is like the chickenpox vaccine or the rubella vaccine. Though a vaccine over pregnancy, the data, because we know it's dangerous. These kinds of vaccines, however, the mRNA, the monovalent vaccines, they have not proven to be like the live attenuated vaccines. So far, what we know is that they're safe. We give other kinds of vaccines in pregnancy. If you're in the United States, we give you the Tdap or the whooping cough vaccine at 32 weeks because we know it's safe. We give you the flu vaccine during pregnancy because we know it's safe. mRNA vaccines are relatively new, though. These, like we talked about, they have little mRNA pieces, and they teach the cell to make a little bit of that protein so your body develops an immune response. While they are new, their mechanism of action has been studied in phase 2 and phase 3 clinical trials, and they've all been very promising so far. Though, so far what we have, it's good. Just because the only reason we can't say it with 100%, 1,000% certainty is just they haven't been around long enough to be able to extrapolate that kind of data. I'm just looking through some of my notes. The Johnson & Johnson vaccine, I'm sure you've heard all over the news, is about the small risk of a blood clot. Yes, that unfortunately has found to be the case, but just to give you context, it's an extremely, extremely rare outcome, really rare case. So I believe that initially it was withdrawn from the market, but now on April 23rd, it's back in the market for use. And because it's such a rare side effect. Though if you're a pregnant mom, you're going to be like, well, do I take it or do I not? One thing to remember is pregnancy is a procoagulant state. There are parts of, especially the postpartum delivery body, you're at a higher risk of blood clots. So just bearing that in mind, that maybe in the postpartum period, or if you personally have a blood clot disease, so you've had a stroke before, you've had a blood clot before, maybe talk to your doctor about getting whether or not you want to hold off on the Johnson & Johnson vaccine. But if you're pregnant and you don't have any of these, blood clot issues, you can get it. ACOG actually says that it's safe. A couple of other things are the side effects. Though I personally, for example, got the Moderna vaccine, and I did have side effects, and side effects, like I said, are normal. This is kind of the new information that I'm giving you. So the CDC is doing preliminary studies on pregnant moms, and so what they're doing is they're having pregnant moms register through a phone app called V-Safe, so the letter V-Safe. It's an app. So if you go on the CDC website, type in V-Safe, they will give you instructions. And if you're pregnant and you've gotten the vaccine or you're thinking about getting a vaccine, please, please, please register, because the more data we have showing more stories that moms are okay, the more reassured all your pregnant moms and friends in the world can be. What they've done is they've looked at miscarriage, stillbirth rate, risk of gestational diabetes, risk of preeclampsia or gestational hypertension, risk of eclampsia, intrauterine growth restriction, preterm birth, congenital anomalies, small for gestational age, and neonatal death. And they've compared these rates in vaccinated women and then just average rates in normal women, and they are the same. There is so far no increase in any of this, and this is very reassuring to me. And I'm not surprised, because I'd say so far about 30 to 40 of my patients have gotten the vaccine, all different kinds. So the Moderna, Pfizer, and Johnson & Johnson at various gestational ages. So I've gotten some that I've received in the first trimester, some in the second trimester, some in the third trimester, and all of my moms are doing great. Their babies are doing great. None of them have to me stood out to be getting, none of them had preterm birth or eclampsia or anything like that. So I believe in this data because that's what I see in my practice. So just to kind of wrap things up, these were kind of fun to read. So some interesting things are So the gist is, if you are pregnant right now and you want to get the vaccine and you're pretty certain about it, go ahead and get it. Don't wait for your OBGYN. If you're still uncertain after listening to this talk, definitely go to your OBGYN and ask, because the more evidence you get, the better you're going to feel. Your OBGYN is going to talk about their personal experience and their patients that they've seen and how well their patients have tolerated. So now that if you hear good reviews from me and my 40 patients that have gone and good reviews from your OBGYN, who you obviously trust and you've been seeing, you're going to feel more reassured. So definitely get it. Definitely ask them, but you don't have to ask your OBGYN. Pfizer, Moderna, or Johnson & Johnson, doesn't matter. Get whatever you have access to. Johnson & Johnson, just bearing in mind that there's a slightly high risk of a blood clot, but it's so convenient because it's just one shot. And if you personally are not postpartum or don't have a blood clot issue, you should really consider it. Or if you're undecided, talk to your OBGYN, because your OBGYN is going to know your medical history better. If you feel febrile, so this is one thing. When I was initially getting the Moderna vaccine, and interestingly, I'm at the hospital where the very first COVID case was identified in the United States. So if you remember back in the day, there was this big hospital talking about the first case. It was Evergreen Hospital. That's where I work at. And so when we were getting the Moderna vaccine, we were told to not take Tylenol or ibuprofen initially, because the idea is that it would diminish your immune response to the vaccine and you wouldn't develop as good of an immunity to it. But now studies show that Tylenol is okay. And so if you're pregnant and you get the vaccine and you're feeling really crummy, like really sick and tired, take Tylenol. It's safe. And Tylenol is safe in pregnancy, so you can definitely take it. It shows that there does not appear to be any impact on your antibody response. In terms of, I talked about that all three vaccines are the same. I mean, obviously, if you're 16 or 17 and you're pregnant, then get the Pfizer, because that's the only one that's approved that age group. So that's one situation where you would want to get, you're only eligible for one. Another thing is vaccine timing. So in the United States, we give the Tdap vaccine after 27 weeks. So if you are around that time your COVID vaccine so that your vaccines are spread 2 weeks apart. So for example, we give our Tdap vaccine, which is the whooping cough vaccine, at 32 weeks. The 32 weeks of Japonde, I recommend my patients to get the Moderna, for example. They'll get the Moderna at 30 weeks. Therefore, they wait 2 weeks, get the Tdap at 32 weeks, and then they wait 2 weeks and get the second Moderna vaccine. So they should be spaced 2 weeks apart. So this makes the Pfizer vaccine a little tricky because the Pfizer is 3 weeks apart. And so you would have to get the Tdap either 2 weeks before completing the Pfizer or starting the Pfizer vaccine series, or 2 weeks after completing the Pfizer series. Though, if you are at that gestational age where you're considering the Tdap vaccine, ask your OBGYN, hey, when do you guys give me the Tdap vaccine? How can I time it? And they'll give you. That's what I always tell my patients. Now, this is only if you're around the third trimester area where you're going to get the Tdap vaccine. If you're in the first or early second trimester, then it doesn't matter, just get it, because there's no other vaccines apart from the flu vaccine. But I don't think it's flu season now anyway, so you wouldn't be really getting it. Though I recommend the vaccine. There's also, if you're Rh negative, which is a particular blood type, and you get the RhoGAM shot in pregnancy, that does not affect your vaccine immune response. Though a lot of patients are like, oh, I'm getting the RhoGAM shot today, I don't want to get the COVID vaccine. No, the RhoGAM shot is not a vaccine, though you can get both of them at the same time. ACOG and CDC both recommend that the COVID vaccines should definitely be given if you're breastfeeding. There is just no evidence to show that there's any harm to breastfeeding moms, and that, just to kind of reiterate, it is safe in pregnancy based off of preliminary data, based off of what we know about how these vaccines work. We can safely assume that they are safe in pregnancy, so you should get them. I'd like to teach about the Johnson & Johnson vaccine. Johnson & Johnson vaccine is very similar to the Ebola vaccine. There is the same type of vaccine. And the Ebola vaccine has been well studied in pregnant moms and shown to be safe. Though based off of that, we can infer that the Johnson & Johnson vaccine is safe in pregnancy as well.
Kichu would say there's a lot of misinformation about infertility. There are stories showing that, oh, if you get the COVID vaccine, you're going to be infertile. This has been scientifically proven wrong. There is just no basis for this at all. So definitely, if you're thinking of getting pregnant or having a hard time getting pregnant, please get the COVID vaccine. It is not in any way or form going to affect your fertility status. If anything, it's going to keep you safe, keep you alive longer so you can get pregnant. Talked about the blood clot. Just to know that, it does affect the minority communities more. And so as Bengalis, we are part of the minority community. So it's important to be proactive as a Bengali to get that vaccine. And so just to wrap up, make sure to look into the CDC V-Safe pregnancy registry. So if you are pregnant and you've gotten the vaccine, you're going to get the vaccine, definitely register because it's going to help all our pregnant moms and help the world in deciding and making sure that it's safe. COVID is a very serious illness. You might not see it in your communities. You might not have anyone personally affected by it, but I am 100% sure that it will in the next year affect someone you know closely. It obviously is in Bangladesh and India, they were seeing definitely much higher numbers, and I worry that it might trickle over and worsen things in Bangladesh. But I'm sure many of you have family members who've been affected. If you are not pregnant and just a general person, man, woman, whatever, definitely get vaccinated. If you are pregnant, and you yourself should get vaccinated, but you should also make sure everyone around you gets vaccinated to protect you. One thing my patients always say that, oh, Dr. Hussain, I don't want the vaccine because I'm at home and my risk is very low. Yes, I understand that. I had a patient who was very similar to that. Lovely patient, wanted to wait on the vaccine, ended up getting the virus anyway from a family member who came home who was asymptomatic and then had COVID during her delivery. And I remember her telling me, saying, Dr. Hussain, I really regret not getting the vaccine because she was so sick. Though the vaccine will save your life and markedly diminish your side effects from the COVID virus if you get the virus. Though it's important that even if you live a socially distanced life and you're not really out and about interacting with people, asymptomatic individuals could bring it into your household and give it to you. It just takes one bad interaction for you to get the virus. But still consider getting it. And then of course, if you are in a high-risk profession, let's say you're working or you're in healthcare like me, definitely get it because you are going to be exposed, and it's a bad deal. It makes no sense. You're much more willing to risk yourself to get the virus than the actual vaccine. Vaccines work twofold because it not only protects you, but it protects everyone around you so that you don't give it to them. So there is an added benefit to that. And it really works exponentially better when everyone gets vaccinated. So I strongly recommend you get the vaccine even if you're pregnant. One thing to consider is if you are about to deliver tomorrow, or let's say you have your C-section scheduled tomorrow, that would wait for the vaccine, get your delivery out of the way, and then get the vaccine. We recommend that, if you're going to have any elective surgeries or procedures in 2 to 3 days from your vaccine, then to change the vaccine date. So if your induction date or delivery date is going to be in a few days, then wait to get the vaccine afterwards as well. If your delivery date or C-section scheduled more than 3 to 4 days out, by all means get it. Cannot emphasize how important it is. I visibly see how amazing the vaccine has been in reducing the numbers for my pregnant moms and reducing the anxiety for my pregnant moms and reducing the COVID numbers in our pregnant moms. Like on the floor, there was always, a COVID patient in the COVID room, and now those rooms are virtually empty because moms are all getting the vaccine. And I have, say, 30 to 40 patients, and there's several other OBGYNs who are also working in the same place I do. So that adds up to hundreds. And actually the CDC, I think, has registered 100,000 pregnant moms already. So pregnant moms are getting it. 100,000 moms have gotten it. And so far, we're not hearing anything dangerous or newly dangerous or traumatic for moms and their babies. So do it not only because it's safe for you, but it's safe for your baby. Though I hope this is helpful. It would really mean a lot if you could comment and say, let us know if you thought this video helped change your mind on getting the vaccine. It would make me feel better knowing that there were questions about this and that this was helpful. Or if you have other questions, you think any other follow-up questions that you had, I'd be more than happy to answer. We'll keep you posted on new guidelines that come out, but this is the hot off the press, most up-to-date guidelines in the United States that so far vaccines are good. So definitely get it. Tell your pregnant friends to get it. And we wish you all the best. Take care, and happy Eid Mubarak for those who celebrate. Bye.